Hi friends, welcome back to my channel EduHub Abhilasha. Thank you for your love and support on my video friends. This is the second part of the image based video which I uploaded. I hope you like the video and please subscribe my channel if you like. Thank you so much for your love and support friends. Beginning with the images of forensic. Right, so here you can see this is the image of grazed abrasion. It can be due to friction burn or due to brush burn, like you can see here. It is seeming that due to accident and rubbing of tire, it is the abrasion. So it is grazed abrasion, right? Now here what you see is that it is like a pattern, right? It is like a peculiar pattern. So this is termed as patterned abrasion, right? So now you can see here it is pressure abrasion, right? Due to huge pressure it is seeing. So this is the pressure abrasion, right? Now coming to bruise, right? So bruise is basically blood collection beneath the skin, right? So this is the image of bruise. This image is of raccoon's eye, right? You can see blackening around the eye, right? It is also termed as panda's eye, spectacle hematoma, and what it is due to? It is due to anterior cranial fossa fracture, right? Also known as ectopic migratory bruise, right? So this is about bruise. Now you are seeing image of laceration, right? So you can see how there is a cut, and it is due to, here also you can see the cut, and first image is of laceration. This second image is avulsion or degloving injury, right? Now you can see this is the image of incised wound, right? And this is the image of suicidal wound. You can clearly see here the wrist of the patient, right? Suicidal wound, also known as hesitational cuts, intentional cuts, tentative cuts, right? So now you can see this is the stab wound, right? Stab wound. You can see the peculiar shape. And friends, don't worry, you will be able to recall this image, this answers through options, right? Just think carefully with calm mind in exam and you will be able to recall, right? And this is harakiri seppuku, not that important, right? Now coming to skull fracture, you can see linear skull fracture here, linear or fissure fracture, also known as fissure fracture, right? Here you can see the depression, so it is depressed fracture, right? Here you can see the Pond's fracture, or it is also known as indented fracture, and it is seen in infants, right? Now coming on to intracranial hemorrhages. Whenever you see idli like hemorrhage, so it points to extradural hemorrhage, EDH. You can see the idli shaped hemorrhage here, right? Here you can see subdural hemorrhage or subdural hematoma, right? Now question can be asked that what structures are damaged in extradural hemorrhage. So injury to middle meningeal artery is seen in extradural hemorrhage, and in subdural hemorrhage there is injury to bridging emissary veins, right? Extradural hemorrhage, also one more important point is that lucid interval is seen, right? Lucid interval, now you will ask question, what is lucid interval? Then it is the interval, like suppose you are conscious, then you fell unconscious, then you gain again consciousness. So interval between two conscious period, okay, it is lucid interval, right? And here you see the subdural hemorrhage, it is in extremes of ages, right? Now coming on to subarachnoid hemorrhage, right? Subarachnoid hemorrhage, it is also due to rupture of berry aneurysm, and patient says that he has worst headache of life. This is the peculiar history in subarachnoid patients, right? And this hemorrhage here, it is the intracerebral hemorrhage, and most common site is putamen, right? Injury to lenticulostriate artery, right? Now coming to forensic ballistics, few points, right? So here you can see entry wound, contact shot, right? Contact shot, you can clearly see the bullet over here, right? Also you can see here cruciate stellate star shaped when over a dense area like cranial vault, right? And here you can see entry wound, distant shot. Whenever there is a distant shot, then you can clearly see there is a difference, like you can see pointed like shots, right? It is dispersed all over. So it is dispersion of pellets, right? So this is the difference between distant wound, and you can see clearly the contact shot, how it is, right? So they will ask you that whether it is of contact shot, close range or distant range, so you can identify, right? This is the firearm, right? So here you can see the stock, here you can see the breech, then there is a barrel, right? And then there is a bore, and then there is a muzzle end, right? Then you can see here Puppy's rule. What is Puppy's rule? When two fractures line meet at the same point, then the second fracture line never cross the first fracture line, right? So this is Puppy's rule, which is somewhat important. And here you can see the bewelling of the skull. So what happens and how bewelling of the skull occurs? So you can read here that as the bullet exits the cranial cavity, the inner compact layer of bones covering the brain appears punched out with the bewelling of the outer table. So you can see both outer table and inner table bewelling, right? So here you can see three images. One is of joule burn, right? Also known as electrical burn, right? You can see how deep is the burn, right? Here. And then here you can see crocodile burn, right? Multiple pitted lesions, right? And here you can see filigree burn, or it is the burn due to lightning, right? So this is important that it is seen in lightning. So this is the image of trench foot, right? Due to moist or cold on prolonged immersion, you can see the pattern, and this is frostbite, right? You can see frostbite, it is due to freezing temperature, permanent damage occurs, right? And most important point you should also remember for this is that gangrene like condition can occur, and the treatment may be that it may require amputation, so it is very serious, friends. Coming on to the another images, you can see first image is of complete hanging, in which complete body is suspended from the rope, and you can see here incomplete hanging, in which partial body is suspended from the rope. Here you can see typical hanging ligature. Here you can see both atypical hanging ligature. In typical hanging, the knot is just above the occiput, right? And in atypical hanging, the knot is a different place from the occiput. It may be below the mentum, or it may be below the ear, right? Different place from the occiput. So here you can see how lynching used to occur. Not that important, but you can see and go ahead. These are very important. Mugging, you can see one person putting hand over the other person neck. You can see here it is manual throttling, manual strangulation, right? Here you can see image of garroting. Here it is ligature strangulation, right? Now you can see image of drowning. In cadaveric spasm, you can see how the person has, this is the typical image which they will give in drowning, right? The person has different grasses and muds in his hand while drowning, and here you can see froth, right? Then here you can see emphysema aquosum, lungs swelling, and here you can see washerwoman's hand, right? Very white. Then here you can see how smothering is done, right? The woman is placing pillow over the head of the men, right? And so smothering. Don't consider it otherwise, just it's an image, that's why I am telling. And this is how choking is done, right? You all know about this. This is positional asphyxia, and here it is barking, right? These two fellow will always be there in barking image, so remember this image, barking. These were the actually two fellow who had killed lots of persons using this method. One used to sit on the person's chest, and other used to give like airway obstruction, right? So this was barking. Then you are seeing here it is tachynoir, and here the image of rigor mortis, right? Here it is rigor mortis or hypostasis, and here you can see the image of tardieu spots. Here you can see image of adipose sear, right? Here it is mummification, and here the image of marbling you can see. Here you can see the image of caput succedaneum and cephalhematoma, right? You can see how cephalhematoma clearly appears. It is more swollen due to blood, and caput succedaneum you can see how it appears, right? So you can get difference. Now various tests like Takayama tests and Teekman tests, these both are used for blood tests, right? These are blood tests. And Seminal test, this is Barberio test in which you see yellow needles, and here it is Florence test in which you see these type of structures in Florence test, right? So this is the difference between blood tests, right? Two tests, two T's, you can remember Takayama, Tickman, Barberios and Florence in seminal stains, right? Now coming on to the poisoning. So this is aconite poisoning, right? Root is most toxic, aconitine is the active principle, hippus and cardiac arrhythmias are its effect, and meetha bhush, meetha zahar, monk, sod is other name for aconite poisoning, right? Now here you can see yellow oriander, right? You can see the typical image of yellow oriander. It is also known as cerebra thebacea. It causes hyperkalemia and arrhythmias. Here you can see pink oleander, right? Also known as Canarnerium odorum, right? Now coming on to how to identify snakes, right? So here you can see common cobra. You can see spectacles in the common cobra. So you can remember that common people wear spectacles. So common cobra is like this, and you can see Karaith. Karaith has bands on its body all over, right? Here you can clearly see sea snake, that is, it is lying on the sea. Then you can differentiate how viper, Russell viper and saw scaled viper different. You can see this is V type scales, and you can see here like somewhat oval scale, so you can remember how these snakes are. Now this is the image of Datura alba, right? Datura active principle is hyoscine and atropine, and fatal dose is 100 seeds, and various effects which it causes: dry mouth, dry skin, dysarthria, dysphagia, dilatation of pupil, delirium, drunken gait and death. And you may also note its treatment, right? Its treatment is physostigmine, right? Antidote. Now you can see cannabis. It is also known as rope, joint, weed, marijuana, grass, right? And active principle is tetrahydrocannabinol, right? It is associated with a motivational syndrome, run amok, flashback phenomenon. Preparations are bhang, ganja, charas, hashish, and majun and sinsemela, etc. Here you can see cocaine, right? Fatal dose is 1 gram oral. Ulceration of nasal septum, cocaine, bugs, Magnon symptoms, very important, Magnon symptoms, right? You cannot forget this. Sympathomimetic, right? So this was about cocaine. Now coming to arsenic poisoning, right? You can see raindrop pigmentation, Means line, right? So this is arsenic poisoning. And lead poisoning, you can see Burtonian line and basophilic stippling. So this is arsenic poisoning and this is lead poisoning. Now you can see various seeds here. It is Abrus precatorius, also known commonly as rati seeds, rati or rati seeds, whatever you call. Each seed weighs 108 gram. Abrin, you must know, this is the active principle. Now this is the croton seeds, right, also known as Jamal Gota. Croton is the active principle, causes intense purgation. Then you can see ricin seeds. Here this is the ricin seeds. It is obtained from castor plant. Active principle is ricin. And here you can see semicarpus seeds, also known as bhilva or bilavinol, is the active principle, and it is associated with artificial bruise, right, artificial bruise. And semicarpol is the active principle. So coming to this is the calotropis. Calotropin is the active principle. This is the Spanish fly, also known as blister beetle or Cantharides. And this is the chili seeds, Capsicum annum, right, human's hand chili burn. This is the image of Papaver somniferum, also known as poppy plant, right. Fatal dose is 2 gram. It is associated with meiosis, respiratory depression. And this is the strychnine poisoning, Nux vomica, right. Even one crushed seed is fatal, right. And it resembles tetanus poison, and spasmic like features occurs in this. So this is the method of taking drug, snorting or huffing. You can see how this woman is taking, or skin popping, right, you can see here. Then you can note how these street children are taking, and you can see this is how this girl is taking. So these all were about forensic. Hope you like this forensic section. Now coming on to the anesthesia section, right. So this is the image of 24 gauge cannula, right. It is yellow in color. Then 22 for blue, you can say. So this is 22 gauge blue cannula. Then 20 gauge like flower, you can see pink, it is pink like flower. Then 18 gauge, most commonly used in trauma, right, 18 gauge, it is green in color. And then you also remember 17 gauge cannula is white in color. It is not shown here, but you remember that. Then it is 16 gauge which is gray in color, and then 14 gauge which is orange in color, right. So these were about cannula. Now you can see the O2 delivering devices here. Nasal cannula, you can see in the first image, it delivers 2 to 6 liter per minute, O2 at the rate of 2 to 6 liter per minute. Then you can see here simple Hudson mask, right. You can see here O2 with reservoir bag, mainly reservoir bag, you should know here. Then you can see here O2 blenders with nebulizer. Here you can see Venturi mask, you can see different Venturi color coded. And here you can see anesthesia face mask used during anesthesia. This is most common, which is ambu bag, right. And this is the rotahaler. This is laryngoscope, Macintosh and Miller. Macintosh is used in adult and Miller is used in children. Now you can see laryngeal mask airway, right. This is the LMA Classic. This is LMA Pro Seal, right. It is second generation. Now LMA Guardian and LMA Supreme, you can see how these are different. Basically you may know that it is laryngeal mask airway, right. Then this is endotracheal tube. This is important. Labeling is also important. This is the Murphy eye. This is the bevel. This is inflated cuff inflation line. Then this is the pilot balloon, and this is the connector, right, which through which circuit is connected. Then this is double lumen endotracheal tube, right. Then here you can see tracheostomy procedure. This is the cricothyrotomy procedure, right. Then this is the anesthesia machine you may all be very familiar with. Now coming to the capnogram. This is the normal capnogram, right. Then here you can see how bronchospasms, shark fin type capnogram occurs. Then this is hypoventilation, very less, only 2 ventilation per minute. Then you can see how many capnographs are seen here. So it is hyperventilation, right. Now you can see here cardiogenic oscillations, right, how it is like cardiogenic oscillations are there. This is very important, curare clefts or spontaneous breathing, right. Here you can see a dip here. Then here it is due to CO2 rebreathe. So these were the few capnographs. And then coming on to the Malam patti grading, right. You can see first class, you can see only uvula is everything is being seen clearly. Here you can see complete visualization of uvula still. Here you can see only base of uvula is being seen, and here you can see soft palate is even not visible at all, right. This is the Swan-Gange catheter. This is the central venous catheter, right. Now various Mapleson circuits. This is the Mapleson A, right. Mapleson B is this one in which both fresh gas and APL valve are closed together, right. Then here you can see there is no corrugation in Mapleson C. Mapleson D, in which fresh gas is distant to the APL valve, right. D for distant, right. And you can see in E how it is like there is no APL valve, right. And Mapleson F, also known as Jackson Reach circuit, which is used in children, pediatric age group, right. Here also you cannot see any APL valve. So this is the APL valve, right. Then vaporizer color code. Yellow sevoflurane, right. Purple is for isoflurane, red is for halothane, and blue is for like blue na, you can remember desi color is blue, so desflurane, right. This is the flexometallic armored endotracheal tube, right. This is various cylinders. Cyclopropane cylinder, which is orange in color. Oxygen, very common, you may have already seen in the hospitals. Black body with white shoulder. Then air, you can see whole black. Then nitrous oxide, blue. And entonox, you can see entonox also, how the cylinder is white shoulder with blue body, right. So this was all about anesthesia. So friends, thank you for watching EduHub Abhilasha. Hope you like this image based sessions. All the very best for your exam. Do subscribe my channel, friends. Thank you so much.